So I'm just going to answer a few questions that have been commonly posed to me in my practice as well. One very common question is, do different LASIK machines affect dryness in the eye? And the answer is no. There's no difference between different LASIK machines as such. However, the position of the flap may make a difference. What is called a superior hinged flap may tend to cause a little more dryness than a nasal flap. Because that transects the nerves which innervate the cornea a little bit more. There are different procedures like lenticular extraction procedures and implantable polymer lens, which cause little less dry eye because they affect the surface less. So LASIK is a procedure where a flap is created in the cornea. The anterior structure of the cornea is elevated in the form of a flap. It's kind of like opening a book. And then the laser does the treatment under that and we put the flap back. Lenticular extraction procedures have smaller incision and less effect on the corneal nerves, and therefore studies have shown that there's less dry eye following these procedures. In a PRK, which is a photorefracted keratectomy, there's no incision, just an ablation. So again, there is better preservation in terms of the corneal nerves. And ICL is an implantable polymer lens where the procedure is done a little differently. You insert a lens in front of the natural lens of your eye. This is generally for treating higher powers. And because there's a small incision again in this, the frequency of dry eye is a little bit less post ICL. So this is a diagrammatic representation of what happens to the nerves. You can see this yellow line is the flap line in a LASIK. And there's more damage to the corneal nerves. You can see those white lines are missing in the image on the left, whereas on the image in the right, the white lines are more marked, which shows that there's less damage to the nerves in the cornea. This is actually done with a machine called a confocal microscope, which takes very, very magnified images of the cornea at different depths. So this is just an illustration to show that lenticular extraction procedures may be less damaging to the nerves and therefore cause a little less dry eye.